Have you ever wondered why mental health stereotypes persist in our society? It's a question that merits our attention. Stereotypes, you see, are like shadows. They lurk beneath our conscious awareness, subtly shaping our perceptions and attitudes. And when it comes to mental health, these stereotypes are deeply ingrained in the fabric of our society, whispering distorted narratives about what mental illness looks like, who it affects, and how it should be managed. These narratives are often perpetuated by the media, which can amplify and reinforce harmful misinterpretations. It can paint a picture of mental illness as something to be feared or stigmatized, rather than understood and empathized with. This, in turn, can lead to discrimination, isolation, and a reluctance to seek help. We must remember, stereotypes are not the truth. They are merely shadows. It's time to challenge these stereotypes and see mental health through a new lens. But first, we need to understand what these stereotypes are. Stereotypes around mental health are deep-seated, pervasive, and often harmful. One of the most common is the false belief that mental health issues equate to personal weakness. It's as if the strength of one's character could somehow prevent or cure these conditions. Another stereotype paints individuals with mental health problems as violent or dangerous. This is not the norm, but the exception, as the majority of people living with mental health issues are no more likely to be violent than anyone else. And then there's the harmful notion that those struggling can simply snap out of it or will themselves better. This disregards the complex interplay of biological, psychological, and social factors that contribute to mental health issues. These stereotypes, these misconceptions, are not just inaccurate. They are damaging and need to be addressed. It's time to flip the switch on mental health stereotypes. Now, let's delve into how these stereotypes affect individuals and society. Stereotypes, particularly those surrounding mental health, can have a profound impact on individuals. They can create a stigmatizing environment where mental health issues are viewed negatively. This leads to discrimination, where those struggling with their mental health may be treated unfairly or differently due to their condition. Moreover, stereotypes can lead to self-stigma. This is when individuals internalize these negative perceptions, fostering feelings of shame, guilt, and inadequacy. This can deter them from seeking help, further worsening their condition. But the impact doesn't stop there. Stereotypes can also shape public policy and societal attitudes towards mental health. When mental health is misunderstood and stigmatized, it can result in underfunded mental health services and inadequate support systems. This only serves to exacerbate the problem, hindering progress towards better mental health care. The ripple effects of these stereotypes go beyond the individual, shaping our society's approach to mental health. It's time to break down these stereotypes and replace them with understanding and empathy. Stereotypes, as we've discovered, can be detrimental, but they are not invincible. They can be challenged, they can be changed. One of the most effective ways to do this is by educating ourselves and others. Knowledge is power, and in this case, it's a power that can help us see beyond the misconceptions. Promoting open conversation about mental health is another key step. When we talk about mental health issues, we normalize them. We make it okay to share, to seek help, to heal. And let's not forget the importance of treating people with mental health issues with respect and kindness. They are not their illnesses. They are individuals with their own stories, strengths, and dreams. By taking these steps, we can start to dismantle these harmful stereotypes, because mental health matters, and so does how we talk about it. Imagine a world where mental health is understood, not stigmatized. Picture a society where the unseen battles fought by many are recognized, acknowledged, and respected. The mind reset isn't a lofty dream. It's a future we can build together. In this world, mental health care no longer hides in the shadows of shame, but stands in the light of acceptance. It's accessible, comprehensive, and tailored to individual needs. There's no judgment here, only understanding. Discrimination based on mental health becomes a relic of the past. It's replaced by a society that champions empathy, celebrates resilience, and values the strength it takes to seek help. This mind reset isn't about erasing the reality of mental health conditions. It's about changing the narrative, shifting the perspective, and promoting understanding over ignorance. Together, we can flip the switch on mental health stereotypes and create a healthier, more compassionate world.